AM 1100.
Welcome back. If you notice on the screen there with our time and temperature, above that is another clock that is running. That's how long we've been in the deep freeze. That is when our wind chill first went below zero. It was at 7:53 yesterday morning, and now 22 and a half hours later, we are still there. And so we want to talk about the dangers of this, especially with young children. Dr. Michael Anderson is here with us this morning. He's a pediatric expert from University Hospitals. Doctor, thank you so much for being here.
Good to be here.
You know, we have to talk about this extreme cold. First and foremost, the best thing for children is to stay indoors.
You know, we're a hardy stock. We're Clevelanders. We're used to winter. We're used to snow. These kind of temperatures, as Holly pointed out, we haven't seen before. So This is really dangerous. Let me say that word one more time. This is dangerous for kids to be out. You know, it's the end of break. There's a lot of schools out. We'd like the kids to maybe get out of the house. This is not the day for it. This is a very, very dangerous situation.
And we were talking before, even last Friday when I had the kids out and we were at a sledding hill, it was warmer, but I saw kids without hats, without gloves, and my kids are all bundled up. They're kind of like, why are we like this when they don't have to? But let's talk first about frostbite.
Sure.
It doesn't take very long for this to set in.
In these kind of temperatures, if you've got exposed skin that is exposed to -20, -30 degrees, you can get frostbite in a matter of minutes. The symptoms are the area gets very, very gray looking or very, very pale looking. That means the blood's not flowing. The child will report that it's tingly. Then it gets painful, and then they can't feel it. So as frostbite gets more extreme, the nerves can actually be damaged. So in these type of temperatures, that can happen instantaneously.
Let's talk also hypothermia, because I think a lot of people don't know the difference between the two.
Right. So frostbite is having an area of the skin exposed, your ears, your nose, whatever. Hypothermia is when your entire core temperature goes below 35 centigrade. A normal temperature in a human is 37. Those symptoms can be really life-threatening. The patient becomes dizzy, the patient becomes disoriented, the patient can become comatose, and God forbid it's not treated or caught, those patients can actually pass away. So this is really, once again, very dangerous.
We had an unfortunate situation yesterday with a Cleveland resident.
We did. UH is reporting that an elderly resident with all their medical problems passed away. But that's also what Clevelanders do well, is check on your neighbors. Make sure that everybody's doing okay. We've got another day or so to get through this, but you know, we can get through it together.
General rules before we let you go, besides don't go outside. If you have to, really keep an eye on them.
Exactly. You should not have unsupervised time with the kids outside today. God forbid they have to go out for some reason. A lot of layers, as you mentioned, a lot of layers. They should like the Michelin Man coming around, and no areas of exposed skin, because as you said, you can get frostbite instantly.
General rule, add a layer more for kids than adults?
Exactly. So if you look at the adult, we in pediatrics say, look at the child and think about one more layer. What an adult would be comfortable with, add one more to the child.
Very good, because they're a little more vulnerable.
They can lose heat very, very quickly. They don't know when they're getting cold. They just think they're outside having fun. So once again, these temperatures are just so dangerous for kids.
Tomorrow we're in the teens. It's going to seem so warm.
And
but
40
still,
by the end week.
Right.
I mean, this
but as far as tomorrow, don't let the guard down, even in teens.
John, that's a great point, because once again, kids can still get hypothermic quickly. Kids can still get frostbite. So you've got to maintain our vigilance until we hit the 40s, I guess.
We appreciate you coming in. Dr. Anderson?
Thank you very kindly.
That sounds so good, doesn't it, Holly? Dr. Anderson?
Oh, the duo up there.
I never got into medical school.
Thank you, Dr. Anderson. And Dr. Anderson.
Thank you.
All right, so as we get a look at your forecast for today, we are still in this